Good afternoon, everyone. My name is Dana Connors. I'm the president of the Maine State Chamber of Commerce. We are your host today, and it's my pleasure to welcome you to the third in a series, a four-part series, I should say, dealing with STEM. We're focusing on the value that STEM brings to meeting our workforce needs in our state and, frankly, our country, but also the opportunity it offers to those who choose science, technology, engineering, math as a career. We've talked about a number of things, all relating to the value of STEM in our previous two sessions. We have emphasized its application, the need for recruitment, how the definition is no longer, if you will, your father's definition. Is not narrow in scope. It doesn't have the perception of the past. It is broad. It applies to so many different types of businesses that are important to our economy today. And we continue the value as we approach today's session, but we do so in terms of what the value is as it relates to a current 10-month battle we've had with that COVID-19 pandemic that's become so much a part of our life. And while the emphasis today is on the biomedical sector, we're going to learn from our panel the way that STEM has been instrumental in helping to stop the spread and has been very meaningful in the impact, minimizing the impact, I should say. Before I turn it over to Andre, who will moderate today's panel, I want to give a shout out to our sponsors, our webinar sponsors, of which we've had the good fortune of having many this year: Central Maine Power, Bangor Savings Bank, the law firms of Eaton Peabody, and it looks like MEMIC may be on there as well. And we thank all of them, and we also thank the Science is Us, who is the sponsor for this four-part series. We're grateful to them, and we thank them for bringing it to our attention. We are pleased to be the host. Extremely important subject matter. With that, I am very pleased to turn it over to Andre, who has been with us before, who represents Science is Us. Andre Porter, that is. The floor is yours, and you have the opportunity to move forward with it. Thank you very much.
Thank you, Dana. Again, my name is Andre Porter, and I'm the Policy Director for Science is Us, a foundation-supported effort that brings together a diverse group of science and engineering, industry, higher education, and labor organizations to galvanize a broad, bipartisan political base of support for science and technology. Today, we have an exciting panel, as Dana mentioned, of panelists intimately involved in addressing both responses to COVID-19 and workforce development for health professions. As a bit of housekeeping, this session is being recorded for on-demand viewing. All attendees will be in listen-only mode for the duration of the session. If you have any questions for our panelists, please submit them in the chat window. Additionally, materials are included in the chat box, as well as will be included with the session recording once that becomes available. Each of our panelists will give a short presentation. We will then kick off a Q&A. Again, if you have any questions for our panelists, please submit it using the chat window, and we will get to as many as we can within our allotted time. Now I would like to introduce our first panelist, Dr. Charlie Ray. Dr. Ray is the Vice President of Education at the Jackson Laboratory, where he leads a team of 23 education professionals. He has been a science educator since 1986, teaching high school and college, and providing professional development for high school teachers and college professors. In 2010, he created the Teaching the Genome Generation program, which aims to increase student genomic and genetic literacy by training and equipping high school teachers. Charlie received his PhD from Yale University and a BA from Amherst College. The floor is yours, Dr. Ray.
Thank you very much, Andre. Let me just share my screen here. Let's see if I can get this going. Where is my, that's odd. Well, that's not what I want to do. I'm not seeing, sorry. Oh, here we go, maybe. Not seeing the ability to share my PowerPoint. So Angie, do you want to run my PowerPoint for me, if that's okay?
Sure, yep, just give me.
I don't know why, I tested this on Zoom this morning.
Okay, so you
Oh,
went down
wait.
to,
No, I got it. Sorry, I figured it out.
okay,
Sorry.
great.
All right. So thank you to the Maine Chamber and Science is Us. I'm pleased to present today. I know my slides aren't quite up yet, but let me know if you can see them
Yes.
or when you can see them. Okay, great. So I want to just start with sort of the take-home message from JAX, and it's sort of two parts. So my comments here will be, will cover both a little bit of COVID response and JAX as an organization, or the Jackson Laboratory, and then how we've used STEM education to build the STEM workforce at JAX. I think the first part is, I started to work at the Jackson Laboratory in 1999, and I'll tell you, we are a very multifaceted STEM employer, and we've continued to evolve and grow rapidly. And what we do envision is a digital transformation with complex genetics, genomics, and human health at our foundation. At the same time, STEM education before, during, and after the pandemic, when we get there, is essential. We had infrastructure in place, educational infrastructure in place to deliver significant online educational programming as the pandemic began. And I think that put us in a good place. As many of you know, since the audience mostly is from Maine, we started in Bar Harbor, adjacent to Acadia National Park, and are growing rapidly in Maine. And so in about 2 years ago, we opened that bottom right. That's our facility in Ellsworth, Maine, with a target of about 300 to 400 employees. It is a state-of-the-art animal breeding facility with robotics and things and automation unknown in the business we operate. We also have a small operation. I'll talk about the Maine Cancer Genomics Initiative that's based at Maine General in Augusta. And back in the early 2000s, we opened a facility in Sacramento, California, pictured here. And then in 2014, opened a very large compared to our production facilities, secondary research campus on the campus of the University of Connecticut Health Center, JAX Genomic Medicine. And we've just announced this week a joint venture with JAX as the majority owner of a subsidiary in China that may or may not have made the news. I do want to say, though, in terms of the dynamism of JAX in the STEM workforce, yesterday I went and looked at our website, and despite the fact that we put a hiring freeze in place in April, and we've just barely lifted it because of the pandemic, we have 66 open positions, and the variety is pretty rich. They include things like a xenograph studies technician, big data software engineers, in vivo services research associates, architects, research project managers, and others. So we remain this very dynamic institution with tons of different styles of careers. We're not just the animal care and research operation we were a generation ago. This, is will show, and I'm not going to go through this slide, but it shows the economic impact of JAX across the state of Maine. We continue to have Maine as our headquarters and will continue to grow significantly within the state of Maine. I do want to say something regarding COVID. I think we recognized the importance of JAX and genetics as the pandemic emerged in January and February. And as early as February, we reached out to a scientist at Iowa and brought in the transgenic mouse that carries the human gene, whose protein is the receptor for the spike part of the virus, of the SARS-CoV-2 virus. We made a huge effort here in Bar Harbor, bringing that mouse from frozen sperm to live animals on the shelf, and then building a colony that could be shared with investigators all around the world that needed to study the basic biology of how COVID-19 progressed. We then went on, and much of this, I'll be brief, much of this was covered in the national press and has been well documented. We then went on quickly thereafter, after being able to distribute these mice, to take that gene construct and put it on controlled diverse animal mouse models. And when I say controlled diverse, so we're trying to model human diversity. All of us are, humankind has great genetic diversity in it. We were able to put this gene across a panel of very diverse mice that model human diversity. Those mice were then sent to the Rocky Mountain Laboratory in Montana, which is the United States National Institutes of Health infectious disease facility, where they infected those mice with the SARS-CoV-2 virus. I will say and reiterate, JAX does not do infectious disease work in any of our facilities. So our mice were sent by collaboration to Rocky Mountain Lab. Interestingly, the initial results showed a wide range of disease pathologies, reflecting the range of symptoms and in human populations. The other thing we did, which didn't happen in Maine, but I'll just mention it because it does have a connection to Maine, we had started a certified or CLIA diagnostic lab at our Connecticut facility in 2015, really to do cancer genomics. And we rapidly scaled that and changed it over to doing SARS-CoV-2 detection testing, positive, negative, or COVID testing as we now know it. We've done about 12,500 tests for our employees and have had no positive asymptomatic cases in Maine after doing almost 6,700 tests of our employees. We also provide services at the University of Maine and Maine Maritime and are testing those students and communities. On the local side, we've also reached out to our community. Several of us in the education group and others across Jackson, Bar Harbor have worked in our communities. And the Mount Desert Island Regional School System is, I think, going to be the only district in Maine that's going to do a coordinated asymptomatic COVID surveillance program. We've provided guidance on how to set up a testing platform, how to do surveillance testing. And I think later this week, they're going to roll out and do a baseline COVID test for the 500 staff that work in the 10 schools in the regional school system. We've also convened sessions for school administrators, as well as 3 student-facing forums, which are upcoming, that'll explain COVID, both the science and the clinical aspects in terms of transmission and vaccines. So we've tried to respond rapidly to what's going on in the pandemic. I'm going to shift gears for a second and go through a couple slides rapidly in respect to the time. In the group that I lead, the team I lead in Genomic Education, we rapidly moved to build out new things. I'm not going to mention all of these, but I will go back to what I said at the outset. We had invested in learning management systems, in an online and digital education team, and hired 2 instructional designers. So we were able to rapidly pivot and move some of our content over to online resources to do STEM workforce development and just general STEM education. And in the case of, for example, our McKusick and cancer short courses, McKusick's been given 61 years in a row, cancer's 30 years old. We saw enrollments jump by 80 or 90%, 8 or 9-fold, not 80%. Going from, let's say, the McKusick 100 participants from around the world to having 600 and actually 900 participants from 12 countries, 26 states, and across 5 continents. Let me mention just 2 things that we did that were COVID related, and then I'll talk a little bit about teaching the genome generation. The infrastructure we had in place, we have been delivering online courses since about 2017. And you can see that as the pandemic struck, a lot of people migrated to the platform we're using now, things like WebEx and Zoom. And we saw active participation and enrollment went up about 350% in our online courses. The smaller bars here are our clinical education courses. These are really for physicians, oncologists, nurses, and so on. And while we did see a bump, I suspect the lack of uptake there suggests that the first line medical practitioners and clinicians are pretty busy doing other things than taking online clinical education courses, which we offer. We did respond rapidly in the education side. And one of the things we answered a call from the National Center for Case Study Teaching and Science. They put a call out for rapid writing of case studies. So this first one here, the power of a test, how COVID-19 is diagnosed. We turned around in about 3 weeks, and it was sent in for publication on a 3-week notice and was published. What it looks like, this is a case study that targets high school students. It's for high school teachers to use in their classes. And we decided to take the angle of what it's like to work in a clinically approved diagnostic lab. We took it from the angle of saying we have a young individual, early 20s, who happens to be working in a diagnostic lab when a pandemic hits, and how the changes occur. We distinguish between the difference between a clinical lab and a research setting. And we simultaneously, along this left panel, you can see there are graphics that are suitable for a high school educator to explain the biology of how the testing is done. I know we have Puritan on board for the swabs, and how you then get the viral DNA and amplify it using polymerase chain reaction to do diagnostics. And so that was a rapid turnaround that we tried to provide due to the pandemic. The other thing, I do want to mention the program we started several years ago, teaching the Genome Generation. This is funded by the NIH. We've worked with a lot of teachers mostly across New England, but we get a lot of folks that want to take this course. It's a professional development program for teachers who you see in the pictures here. The idea was that we would highlight genomic variation, but also use it as a tool to excite and engage high school students about biology, but more particularly about genetics, genomics, bioinformatics, and bioethics. Historically, the program has run as a full week. Nobody pays for this. We actually pay teachers to come to it. A full week of professional development. This is taken at Bowdoin College. We've used Bowdoin as a resource because of their labs and their dormitory space. But because of the pandemic, we've shifted gears, and we've now produced a completely online professional development course for teachers. And it covers the same 3 parts of our curricula in terms of molecular genetics, bioethics, and bioinformatics. It is not focused on COVID, but I think as a result of COVID, we had wanted to build an online platform to do online professional development. We accelerated that due to the pandemic. The program has been quite successful in Maine. We've had about 6,800 high school students who've used our curriculum and done 21st century molecular genetics labs across the state. And this includes the professional development for teachers. We've worked with 72 teachers across 63 high schools from Aroostook County to York County. And students, this is a high school in Scarborough, I believe. They send us great results about how excited they are to do real research, in their words, and get excited about following STEM careers, which we think this early part of the STEM pipeline is essential. I think one of the questions that might be out there is how could we work with higher ed to fill STEM jobs in the future? And going forward, this program, we're hopeful to get a second 5-year grant from the National Institutes of Health. And the focus of that is actually pre-service teacher education. We have the University, Farmington, Southern Maine, and Bowdoin, who all have teacher ed programs on board. And we're going to now target doing pre-service teacher education with our program. So we are actively trying to engage. We have a long-term relationship with Colby, and we're developing a cancer genomics pilot project with them to get kids excited about research, but also the clinical sides of cancer. I don't want to fail to mention, as I close out here, a couple comments. The other thing Jax has done, which is an interesting project, while not directly related to a COVID response, about 4 or 5 years ago, Jax got a gracious award from the Alphon Foundation to start the Maine Cancer Genomics Initiative. This project provides genomic testing of tumors for patients across the state of Maine. And we're glad that after a couple of years of uptake, we've convinced 100% of the oncologists across all the practices in Maine, shown here on the slide, to participate. In most cases, community oncologists do not have access to state-of-the-art genomic testing of their patients' tumors, nor do they have access to clinical trials, which generally are associated with academic research centers such as Dana-Farber and others in Boston and other major medical cities. We've actually been running genomic tumor boards. This is virtual, and they've been quite successful. Physicians, oncology nurses, physician's assistants, community oncologists can sit in on these sessions and gain access to the knowledge of experts from around the country that we convene. And they talk about each patient and what the best course of patient care is, including gaining access for patients to clinical trials with no cost to pre-approved drugs to address that specific mutation. So these are some of the things I think that that I just wanted to mention in terms of response to COVID, but also workforce development. I just want to reaffirm that we're seeing, and Jax is, as I said at the beginning, is anticipating a digital transformation. So we see growth in STEM being significantly digitally affected, and we think data science, as it relates for us to genomics and genetics, is going to be a huge growth area where Maine is well positioned and where we want to go. And I'll stop there. Thank you.
Great. That was a great overview, Dr. Ray. A lot of interesting things, a lot of opportunities for the youth in Maine to get involved in STEM at an early age or in high school and develop a passion for the careers. Next up, I would like to introduce our second panelist, Derek McKinney. Derek is a senior manufacturing engineer and project manager for Puritan's COVID-19 manufacturing expansion. He's currently managing Puritan's engineering team, tasked with expanding foam swab production from 40 to 100 million swabs per month. Derek interned with Puritan during college before leaving the state to work for Becton Dickinson, where he was a project manager for pre-analytical systems prior to his return to Puritan in 2017. He earned a bachelor's in mechanical engineering from the University of Maine. Derek, the floor is yours.
Thank you, Andre. Let me just get my screen up. Awesome. I'd like to just first thank the Chamber and thank Science is Us for the opportunity to take part in this panel today. Puritan, I think, is a little bit of a well-kept secret in the state of Maine and the manufacturing world. And with our response to COVID, we've been in the media now more than ever. So I'd just like to start with a quick overview of where we started and a little bit of the company's roots. Originally founded in 1919 as the Minto Toothpick Company in Saginaw, Michigan. In the early 1920s, the company relocated to Maine to be closer to natural resources, white birch, which was used for the manufacturing of toothpicks. Throughout the 1940s and 50s, Puritan started manufacturing medical woodenware, flatware products such as tongue depressors, cervical scrapers, and wooden applicators, which led into cotton swab manufacturing. And over the years, we've become the largest swab manufacturer in the world, servicing 6 independent market segments, and the only domestic manufacturer of COVID-19 testing swabs at the start of the pandemic. Just to outline our response, given our role as a specimen collection device manufacturer, we were very, very early on in discussions with the White House Coronavirus Task Force, starting about mid-March. From that point forward, we were engaged in several capacity planning activities to understand how we could better supply the nation's testing needs. On April 29th, we were awarded $75.5 million in DPA Title III funds to increase our foam swab production from 20 to 40 million swabs per month. Since that initial award, the market need has increased to over 100 million swabs per month, and we'll be ramping up our first Pittsfield expansion facility to meet that need. Following our foam expansion, we were again engaged, this time in reference to nasopharyngeal flock swabs used for PCR-based testing. And on July 29th, we were awarded $51.15 million to take our production to 50 million swabs per month starting in April 1st, 2021. So both of these efforts have been massive undertakings for Puritan. We started, we had one small facility in Guilford, Maine, and in a matter of months, we're now looking at 3 facilities with 3 times our current output. So that the growth and the bench strength that needed to be built was above and beyond anything that we've ever seen. And the schedule was compressed for our first Pittsfield facility to 8 weeks from more or less contract award to start of production. So that facility is shown here. It's 110,000 square feet. We were able to purchase an existing facility in Pittsfield, previously Edwards Manufacturing, and we retrofitted it with the help of Chimbro. In about 8 weeks, we've 40,000 square feet of Class 7 cleanroom manufacturing space, with the remainder of the space being for offices and warehouse. This was a momentous undertaking, and we are now roughly in the 40 million per month range of foam swabs, and starting to bring online now high volume, high speed automation, which is something that's new to the company, new technology, new requirements, new skill sets to meet the market need. Just in case anyone doesn't know, this is a foam tip nasal swab. It's used mainly for lateral flow devices such as the ID Now test manufactured by Abbott. It's very commonplace for rapid tests, dry transport systems, flu testing. Can also be used as a throat swab. Our third manufacturing site, a rendering shown here, will be opening in Pittsfield as well on April 1st to manufacture specifically nasopharyngeal flock swabs. And just for reference, this is the standard COVID swab that everyone's become intimately familiar with. And this facility will be targeting, as I said, 50 million per month. Volumes above and beyond anything we've ever really produced. So it's ramping technology. It's the need for additional engineering resources above and beyond anything we ever imagined we'd have as a company. So that it's tremendous growth. Current challenges at a high level. For our 3 facilities, we've traditionally been very vertically integrated. We've done all of our own machine design, development, and build in-house. But we were tasked with manufacturing 114 new lines this year, which was beyond anything anyone could imagine. So that taking and maximizing our internal engineering resources to understand how we could achieve this goal, utilizing outside workforce vendors. We partnered with Bath Iron Works on our first Pittsfield location to build 30 manufacturing lines. And we worked with industry-leading businesses all through New England to achieve this goal. In terms of employees, Puritan pre-COVID employed approximately 500. Moving forward, we'll be close to 1,200 people. That's a delta of about 700 across the 2 sites, complete new hires. So this required massive changes, not only to how we handle HR, but our training procedures and our internal development. As part of the ramp up here from sort of our legacy manual semi-automated processes to fully automated, integrated, high-speed solutions, there's a transfer in technology and skill set and knowledge that we've had to address, not only at a engineering level, but also at a technician level. so that generally speaking, the technical competencies are much wider now for the business. One response to that was obviously we had to establish for the first time a real engineering team to support these new facilities and this additional technology. In the past, we were able to maintain the business and meet the market needs with a much smaller core team. So basically what we've done is we've taken our sort of spread out small group pre-COVID engineering staff of really 4 individuals, pulled that in to be the core of a new department focused on supporting these 3 facilities. We're now at a staff of 13 working towards a projected post-COVID need of 20 to support ongoing manufacturing and operations, which tremendous growth for us, well above and beyond anything we were prepared to deal with in such a short window. I mean, again, just a matter of months to make this transition, really going from very well-known processes to new, highly automated, new technology, new controls, new programming, new robotic integration, all for the first time. In addition to our engineering needs, as I mentioned earlier, our technical staffing, our machine technicians, skilled mechanical and electrical techs. Pre-COVID, we had approximately 60 on staff in Guilford supporting a 2-shift operation. We're currently staffed at 105 with our second facility up and running, with our proposed post-COVID staff, approximately 160 of all experienced technical individuals, which is something that, again, numbers far above and beyond what we ever thought we would have to develop. And one large challenge we deal with is that swab manufacturing isn't something that you can get exposure to just anywhere. There are very few people that do it. It's very much a niche industry. And the training requirements that we have in place and systems we have in place were built around a very small organization, very little turnover, technicians and engineers on staff for 20 and 30 years. And transferring this knowledge quickly to a mass amount of people was a completely new event for us. We had very little experience in developing technical staff at this rate, at this volume. So we really had to take time early on to develop a robust training program, pulling in techs very, very early in the process, at the very start of the project, so that we could start to build all of this knowledge to support the swab manufacturing and really have people understand the secret sauce that is the manufacturing of a swab. And that was a huge challenge coming out of the gate and being able to produce at volume with very little margin for error. Failure here was not an option. We had to come out of the gate able to meet the needs and perform as we were held to commitments. As we've grown and changed, I think looking ahead to really see how we're going to get to where we need to be. As I said, we've been a secret, right? We haven't done a great job because we haven't had to be out and involved in developing our technical staff. But this rapid growth has forced that. And we need to increase our partnerships with educational institutions out across the state. We need to get in more to the university system and have a presence to new graduates, students in school, to understand the opportunity that's available to them here in the state of Maine with what we're doing. In parallel with that, we also need to focus on our internal development and our training programs here for our own people to make sure that we're able to make the next jump and get our staff from our legacy manufacturing products and methodologies to a different level, much more involved automation and robotic manufacturing, something that is not necessarily out of commonplace in other industries, but just new to us, new to the area, and having to build that support here in-house. In response to engineering as well, I interned with the company, but at that time it wasn't commonplace we had never made really a formal internship opportunity or position available. And moving forward, that's really something that we want to have in all the sites, and start to foster that internal growth, building our staff, and really building up the internal talent here, understanding that it's going to take some time to build that system, but really where we need to be. And lastly is to keep our existing relations that we've made with many Maine-based recruiting firms to help us pull talent in. We've been, so overwhelmed with the growth and the rapid pace of work that it was really, beyond what we were able to support without all of these Maine organizations pooling together to help us achieve our goal. It was really, it's been a great project to be a part of, and it's been a very amazing transformation of Puritan as we move from really a single location in Guilford to being three or more possible locations, and an absolute the industry leader for diagnostic specimen collection. Again, just want to thank the Chamber and Sciences Us for the opportunity.
Great, thank you, Derek. It's a lot of amazing stuff, and I know everybody around the virtual table can give a virtual claps and applause for the work that Puritan has done to help us adjust and really develop a comprehensive response to COVID-19. So we are now going to shift to our final speaker for today's webinar series, and that will be Dr. Candace Chen. Dr. Chen is an associate professor in the Fitzhugh-Mullen Institute for Health Workforce Equity at George Washington University. Her research focuses on the role that health workforce and health professions education programs have in addressing the priority needs of underserved communities. She was previously the director of the Division of Medicine and Dentistry in the Bureau of Health Workforce at the Health Resources and Services Administration, where she led programs to enhance training in primary care, oral health, and geriatrics, including graduate medical education programs in children's hospitals and teaching health centers. Dr. Chen is a primary care pediatrician who continues to practice in Southeast Washington, D.C. Please take it away, Dr. Chen.
Thank you, Andre, and thank you to the Chamber for this opportunity. It's always interesting listening to somebody do your bio and recognizing how much I'm pushing you to say a lot of words that don't always make a lot of sense together. But let me get my slides up. And I also just have to say how really interesting it was to hear from Jackson Labs and from Puritan about this real need to have a workforce ready to respond to situations like COVID. And what I'm gonna turn to is another area where that has been very, very true and is very, very much in the news right now, and that's the health workforce. I am a health workforce person. That's what my academic career has focused on. And as Andre was mentioning, I spent a couple of years working in the federal government managing health workforce development programs. And so I'm going to take a little bit of a perspective at STEM and at COVID and our response to COVID, focus on the health workforce. And as a health workforce person, one of the things I always kind of point out is that for anybody, whether you're in healthcare, whether you're in biotech, you should, if you care about healthcare, then you should care about the health workforce, because there simply is no healthcare without the people who deliver it. And there's no people to deliver healthcare. There are no healthcare workers without STEM development. What I wanted to start with, though, is on COVID specifically, and some of the things that we're looking at with COVID. This is actually a map and some work that we did out of our institute, looking at the sufficiency of different parts of the health workforce to meet the COVID-19 demands, and it's at the state level. I definitely thought it was worth showing. This is looking at ICU doctors. It's a little bit dated. It's from November 20th. At this point is the last time we ran ran the analysis at state level, but I definitely thought it was worth sharing because obviously you appear to be doing something right in Maine, and I wanted to recognize that. But you can see how much of the United States, and we're really seeing it in reports coming out from hospitals across the country right now about really concerning health workforce shortages, particularly in hospitals as COVID cases, COVID hospitalization, and COVID ICU beds are increasing, or the demand for ICU beds is increasing. I do want to say though, I wanted to show you one. Oopsie, that was too far. One other pseudo map. Which is just because at the state level, Maine looks pretty good, doesn't mean that all hospitals are doing well in Maine. This is actually something that came out of a recent NPR article, but they were pulling data from the CDC where hospitals were reporting whether or not they were seeing critical staffing shortages. And you can see Maine up there is about in the 20 to 30% range of hospitals in Maine are reporting critical staffing shortages. And so what does all that mean? The sufficiency of the health workforce. It means that hospitals are really challenged right now with meeting both the COVID and other healthcare demands. So it's not just the COVID cases, but it is when people are showing up with heart attacks or concerns about delayed diagnosis for cancer and treatment for cancer and all of the other things. Not only is it happening in hospitals, though, it's happening in our outpatient settings, in our primary care, and also in our nursing homes, those high risk communities, and real concern about the sufficiency of the workforce to maintain a quality of care in those settings, and prevent illness and prevent death. And then on top of it, it's not just right now that we're really concerned about. We are more and more concerned about what's going to be happening in the future with the workforce, with the health workforce itself. There's issues of illness, death. Then there's issues of burnout. We're exceedingly concerned that as our healthcare workforce is facing a situation like nobody has seen in their lifetime, that post-traumatic stress disorder, mental health issues for providers themselves, burnout is going to be a real problem in the future. We're really concerned about practices closing and physicians and other practices going out of business because of the financial viability. What is that going to leave us after the kind of immediate COVID period? So a lot of concerns about the health workforce right now. And not only do we need to do short-term address this, but we need to think about long-term. And if we're going to think about long-term, we have to think about STEM and what is the pipeline coming up into this health workforce. So, again, health workforce is really important. I actually thought, I will comment, I think from Jackson Labs and maybe from Puritan as well, that there's obviously an interest and an investment and a desire to invest in STEM and kind of bring up your future workforce, that there is some self-interest there, but even when you're not in healthcare organizations or in biotech, even when you're not in the sector, I think that there's a lot of reason to care about the health workforce. Access to high quality healthcare is going to be important for all workers. So no matter what sector you're in, the people who work for you yourself need to be able to access healthcare. And again, there is no healthcare without the health workforce. And then the other thing I always think about is that our healthcare sector is approaching 18% of our GDP, which means that the healthcare sector is a major employer and it's exceedingly important for the economic well-being of our communities. So when we think about the health workforce, what I tend to think of is both short and long-term STEM investments. One of the real challenges, when I showed you those ICU doctors, one of the real challenges of the hospital workforce and some of those physician workforces is it takes a really long time to produce one of those physicians. For an ICU doctor, it's 4 years of medical, 4 years of college, 4 years of medical school. For an ICU doctor, it's 3 years of probably an internal medicine residency program, and then it's another 2 years of ICU fellowship. So, but, you know, that is, I didn't even do the math in advance. That's 8, 9, 10, 11, 12, 13 years, 13 years to make one ICU doctor. So these are long-term investments. Other workforce, nurses, 4 years, bachelor degrees, or 2-year community college. And then there are other workforce that is, again, critically important. Our medical assistants, our certified nursing assistants, our community health workers, all workforce that it has been a challenge, and that COVID is putting even more pressure on, but that we absolutely need to be able to address not only COVID, but all of the other healthcare issues and the needs of our communities. Hopefully, when we get to the other side of COVID. And again, all of this depends on STEM development. So one of the things to think about is both the short term and the long term. And it's really interesting. We see communities investing in different ways. I'm going to admit, I Google searched certified nursing assistants and found a training program at the Maine Medical Center. That's an 8-week program where students actually receive $200 a week stipend. And I did not look to see who funded it, but I would be completely unsurprised if that is coming with either state level or community private funding support. And there are other investments going on in the state and in different communities. One of the other things I will point out, and this is becoming really, really apparent with COVID, is the need for fair and safe working conditions. And so for all of these workers, the access to personal protective equipment, wages matter. For those nursing homes, oftentimes oftentimes the wage that you can make working in a nursing home as a direct care worker is less than the wage that you can make working at a Target these days. And so being able to recruit and retain workers in a very difficult setting that is both mentally and physically challenging is, we have to think about what the wage and the practice supports are for those individuals. And then the other thing I think that's always really important to think about is career growth and opportunities and career ladders. The opportunity to bring people from STEM into certificate programs up into potentially nursing or other programs, and to continue to career progress from there. Incredibly important for both recruitment and retention. So what I actually wanted to do then was actually talk about some of the federal programs that are in some cases coming into the state, in some cases maybe an opportunity for the state that might be worth paying attention to. One of the things I always point out is that in terms of the physician workforce, both the Medicare program and the Medicaid program make some significant investments and payments to teaching hospitals to support the residency training that's required to produce physicians. But one of the very interesting things is on the Medicare level that there is some real inequitable distribution across states. One of the things and some work that we did, it's a little bit old now, but because of the way the policy is developed, it's probably not that dissimilar, is that the Medicare program, which at this point nationally is over $12.5 billion of payments to teaching hospitals on an annual basis. But Medicare supports 22 residents per 100,000 population in the state of Maine. But if you compare that to New York, Medicare program is supporting 77 per 100,000 in the state of New York. And why would you care as a state? You might care because what we find is that where people do their residency, they're actually much more likely to stay and practice. The Medicaid program also is seeing both a significant state and with federal match. And in the state of Maine, from a GAO report from a couple of years ago, the state was putting in about $5 million and the federal match was about $8 million to support residency programs through the Medicaid program. And the reason I point that one out also though is because across states, we're seeing some real innovation in the Medicaid space into targeting those Medicaid dollars to get something and to fill workforce gaps, we'll say, in states and in communities. We also are seeing states take more state dollars to leverage and bring in more federal dollars to support that workforce development. In Medicaid programs in general, we're starting to see waivers where states are taking their Medicaid dollars and doing explicit workforce development, and oftentimes health workforce development. And oftentimes this isn't just in the physician workforce, but it is across different kinds of health workers. There are explicit federal health workforce development programs from the agency that I used to work in, from the Health Resources and Services Administration. There are a number of grant programs that go out to different organizations, but oftentimes to those academic health centers, to your medical schools, to your nursing schools, sometimes to your hospitals, to support explicit training programs to develop this workforce. There's primary care training, there's nursing workforce, there's geriatric workforce. There's also a number of pipeline programs. One that is relatively well known is the Health Careers Opportunity Program. I point that one out though, because for example, the Senate Appropriations right now is trying to zero out that program. What that program does is it explicitly invests in programs that are supporting oftentimes high school students to move up into health careers. And one of the other things I point out is community health centers, and that there's increasing opportunity to partner with community health centers for training, and that HRSA is making some explicit investments to try to stimulate that. Health centers we find are great because they're very close to the ground. They work in their patient population. They're oftentimes identifying and supporting students who can be moved and supported through their through high school into college into health careers programs and into your future health workforce. There's also programs, for example, at the ACF, which is the Administration for Children and Families, which this one has a very unfortunate name. They call it the Health HPOG, which is the Health Professions Opportunity Grants, and that is explicitly to support training for recipients of TANF, for the TANF program. One of the interesting things though is that obviously it's not just the health workforce explicit programs. The topic of this is STEM development, and health workforce is one of the kind of recipients of and beneficiaries, I would say, of STEM development. And maybe something that I'll observe from my time in the government is that the health workforce programs have a tendency to like to hang out separately from the labor development workforce programs. But I think that what we're starting to see is that on the ground, people are really starting to figure this out. And under the Federal Department of Labor, there's the state workforce boards, which I know, Maine's state workforce board is very active. Oftentimes, somewhat in the healthcare space, but we're really starting to see people in some states, particularly in Washington, take advantage of the apprenticeship programs to train individuals like medical assistants. The interesting thing I think then is really being able to take those apprenticeship medical assistant programs and develop them to career ladders, because if you don't support your individuals in the earlier part of the career ladders, you'll ultimately lose them out of healthcare, and we really do need them. And so I think that there are a lot of opportunities. We see some really interesting innovations. One of the very interesting things as an observer of innovation in the healthcare space is we not infrequently see some of it being funded by non-healthcare organizations, but by businesses who know that that it's important for their workforce. And so, making investments to ensure that there's healthcare access to be able to keep your workers healthy, to be able to keep your workers at work. Really interesting things like investments in telehealth. So that an example is a telehealth investment that was actually by the local employer, a large local employer who was not in the healthcare industry. But they invested in the telehealth because it was telehealth that was connecting pediatricians to schools. And by being able to provide that service to kids in schools, what they found is that they could keep their workers from having to leave work to take their kids to the pediatrician, miss work, and ultimately affecting their the bottom line in their workforce. So really interesting opportunities and partnerships out there, and yeah, and lots of opportunities. So I think that's what I got.
Great. Thank you, Dr. Chen. That was very interesting. I think there's a lot of good opportunities and a lot of good resources for the different communities in Maine to employ as they grow their public health workforce. So now we're going to shift the discussion to the Q&A portion of today's webinar. As a reminder, if you have a question for our panelists, please submit it via the chat window, and we will get to as many as we can within our allotted time. First up, and this is for any one of our panelists, it's pretty broad, and it speaks to future projections as it relates to how the U.S. and Maine in particular is pivoting as it relates to COVID-19. So could either one of you, or Dr. Chen, Dr. Ray, or Derek, talk about how you see either your industries or the public health kind of broader sector changing over the next 18 months in response to COVID-19?
I'll take that one on, Andre, at first. Just observations. So I think one of the effects on our workforce at JAX, what we've discovered, we had actually done a strategic campus planning operation for many of our facilities. And we've gone into a mode where having much more flexibility in how we manage the workforce and who needs to be in the office and who doesn't. I mean, it's a fundamental shift in how our workforce is deployed. I think it makes it more flexible. I think what we're seeing is we may hire people that are semi-remote to our campuses, so that from the workforce standpoint, some folks will rarely have to come in. And I think, I'm an educator by origin. I will say that I do think that in person, small ratio teacher to student or learner will remain super important. I think online education, which has grown rapidly in our portfolio, as well as what the colleges and universities are doing in remote learning, is here to stay. What that's going to have an effect as a workforce, I don't know yet, but I imagine a lot of online teaching, and we're going to need to train folks that are going to be instructors and educators how to operate in the space we're all in today. Just a little bit of an observation there.
I think it's such a good question as to what's going to happen next. I'll say from the health worker and the health workforce perspective, again, Maine looks pretty good right now, and I hope that you continue to look that way. Across the United States, it is looking very concerning. And one of the biggest problems is back when we saw New York peaking in March, April, May, we had pockets of COVID spikes, right? And you saw California and Georgia and communities across America sending health workers to New York, right? And one of the real concerns that we have in the next couple of months is that the rising cases and the demand on health workforce is so spread out that people aren't going to be able to do that. There is no there's no plan B this time, right? There's no and so there is a lot of concern. And so for Maine, I'm crossing my fingers that you guys just keep doing whatever it is you're doing, and you guys keep those case numbers down. Across the United States, there's a lot of concern, and there's going to be long-term repercussions. And and I'm so glad that you're thinking about this now, about STEM now, because we don't want to wake up again in 5 years and be like, oops, we should have made those investments 5 years ago and started making those policy changes and those investments and be in the same situation.
And
Great.
Derek, here, no, that's okay. Just from I think our long-term lookout just on testing as a whole is that it's not something that's going to go away anytime soon. If anything, rapid tests are going to become a very standard part of life. And that's really what we're preparing for, is our volumes that are, to possibly say testing the population in a matter of months versus over the course of a year. Compared to, flu volume, the volume of flu tests that we've done in the past. I mean, this is 100x. So it's very much a different world moving forward.
Great. And Dr. Chen, you mentioned in some of your slides, you included some resources and programs that already exist. So I'll open up to the full panel, and if you have other examples, that would be great. But and specifically what the question states is, what are some good examples to grow a robust STEM workforce in the biomedical public health sector, both within the state, and Dr. Chen, if you have any examples nationally that the state might be able to use or decision makers might be able to use to capitalize off of or recreate. We don't want to reinvent the wheel. We want to use resources that already exist, of course. So I'll turn back to the panel to see if they have any ideas on or examples of those type of programs.
I think one of the interesting things that we haven't talked about is just education, not health professions education, which happens pretty late, in all honesty, right? Like I think the one picture I showed you was all post high school, right? And I'll tell you, the thing that people who have worked on pathway pipeline programs know is that you have to start really young, like elementary school or younger, right? And so we've got this interesting issue where, not interesting, but this horrible issue where our primary education systems are struggling under COVID. And so, policies that invest, that support our most vulnerable should all be part of this conversation. But on that idea of what things have worked, I always think I think I talked about the health centers, and the health centers, if you don't know them, are community health centers. They're a program that is funded by the federal government, primary care practices generally that focus on serving the highest need populations. But across the country, we've watched health centers partnering with communities to the point where, like, you see, I've been to one in New Mexico where they had all of the social services on campus with them, and then they started their own STEM high school effectively, right? So it's partnership, and to make those partnerships and start those partnerships, sometimes it's with federal, state funds, sometimes it's with private funds to get them started, to keep them supported. In the long term, everybody benefits. They are long-term investments. So I think many of them struggle with getting the initial investments and then getting the continued support.
Andre, I agree with Candace. I was involved with the Maine IMBRI program, which supports biomedical research development in smaller states. For 10 years, I did that, and I will say there's an exemplar that's sort of what Candace described, which is a linkage between early STEM education all the way through college and up into graduate programs. And the exemplar that I'm aware of is at West Virginia University. They have a SEPA grant similar to what we do with TTGG in the funding source from the NIH. They engage middle schoolers in community-based participatory research about health and health practices. Those students go and sort of do a summer experience, I'll call it a summer camp with their teachers. Students are then encouraged to go on to the next stage, which is university or college level biomedical programs at West Virginia University. If they finish the high school and then the collegiate program, they get free access to medical school or healthcare education at West Virginia University. And they've been doing this about 20 years. And it sounds like a small scale thing, but they've successfully demonstrated that those kids that grow up in rural, under-resourced communities in West Virginia, probably similar to a lot of communities in the rural parts of Maine, stay in their communities, they work in healthcare, they work in community, HRSA community practices. It is working. So there is the exemplar that Candace described where you link early STEM education to career. And a lot of people have looked at that program and really seen the success in a rural state.
Great. And so to tie that in to one of our previous sessions, there was a significant amount of discussion around K through 12 preparedness for kind of the careers of the future for these STEM jobs. What type of disciplines have you guys seen in your own work, or not anecdotally, but in your work as educators, as folks working on workforce development in public health sectors, as the disciplines or the training that require the greatest need at the elementary level, that or in Maine nationally, that would be ripe for either reinvestments or ripe for some increased emphasis, so that the students are prepared for those jobs, whether it's a technician or it's the medical doctor?
I'm pausing a little, Andre, because I'm not elementary education is not something I'm really that well versed in. I did serve on my local school board for 12 years. I would say what we're sensing, and this would be more middle school and on, is understanding and manipulating data sets, understanding good data practices, which sounds pretty rudimentary. But simple things like if a student in the middle school bands was able to understand how to organize data in a spreadsheet, a Google sheet, an Excel sheet, so that they're using the same convention for standard things like a date convention. I imagine that these good repetitive skills that sound rudimentary are essential to good data practices, which will later lead to potentially understanding how to manipulate data, how to work with data, analyze it, visualize it, whether it's healthcare data or not. I mean, I think we're going to a world where being able to have some skills on the data sciences side are essential.
Yeah, I think that's a very good point. Data collection, systematic problem solving, it all starts with the organization of the data. And it is very rudimentary, but something that I think gets overlooked.
I cannot speak to the needs in elementary school, but I will say, as I am a pediatrician, and I would even take us earlier than elementary school and talk about our investments in early education, whether that's explicit like Head Start programs and the support and availability of Head Start programs, to early education services are all is all part of that, and there's work to be done to make sure that when kids hit kindergarten, that they're ready for kindergarten, right, and that they're going to be successful.
Great. So speaking to the other end of the pipeline, and everybody's kind of touched on this a little bit about the need for a better connection between the institutes of education, the technical colleges, the four-year institutions, the medical schools, with the industries that will hopefully eventually hire those folks. So could you speak to specifically ways that these programs can be better coordinated? We've heard about this in our other sessions, but also I think that's a national discussion around the lack of skill or the imbalance between the needs of the industries with the needs of the teaching professional, or how people are being instructed, the skills they are developing there. So could you talk about, or anybody on the panel rather, talk about ways that we can connect those, that end of the pipeline?
I'll go first. I think that is such an interesting question, and and I love the fact that I assume that in the audience there are people who are not from the healthcare industry, and there is such an interesting thing about a couple years back. There was somebody who was I cannot remember what his title was, but he was from IBM. He worked at IBM. And from IBM's perspective, even though IBM does do things in the healthcare space, he was very focused on the idea of primary care and shifting our focus from focusing on kind of those downstream, highly specialized care to upstream primary care and prevention, right? If we can prevent people from needing the hospital, even better than being able to treat them well in the hospital, right? And we have a real challenge in healthcare and in our physician workforce of, we'll say, over selection into the specialties and under selection into primary care. And he used to run around from IBM and basically say, IBM doesn't want to buy what you're selling anymore. And he would say this to the medical schools, and he would say this to the residency programs, very much with IBM as a purchaser of healthcare, right? Saying back to healthcare organizations, we want something different from you because we care about our health workers, right? So there's a very interesting thing, you know, we got so many issues in healthcare, to be honest, about disparities, about healthcare systems being set up to continue to support those disparities. Those disparities underlie economic inequality and economic instability in your communities, right? And so when communities come together to look at healthcare organizations and then the pipeline, whether it's medical schools or nursing schools, or to say, we want something different from you. We need something different from you, right? And to use that collective power to put pressure back onto, to demand something different, right? And that's when medical schools, nursing schools, fill in the blank health professional schools will start to respond.
Great.
Andre, just quickly, I think I didn't mention it too much, but, we have a clinical education program that's really, we issue continuing medical education, continuing nursing education credits. And we recognize that healthcare workers are extremely busy. So we're trying to give them very short, 15, 20 minutes online education credits. But, going back to my comments about the Maine Cancer Genomics Initiative, I think we recognize that on the ground, oncology nurses and nurses in these practices in rural communities, they need this training. In fact, they do much of the healthcare work with the oncologists coming in. And so we are trying to tailor education in that small space to an audience that is that's doing much of the work. And I think to change course a little bit, the other thing I'm impressed with is many of you may have heard of the initiation of the Rue Institute in Portland, and them working directly with employers on what are the skills your employees need. This is the new institute down in Portland. I was down there on one of my only business-related travel in 8 months, and visited them last week, and was all masked up, PPE, and was really impressed that they're going to the workforce and saying, what skills do your employees need at that further end, not in past higher ed and professional and medical schools. So we're getting there in Maine. I think it's promising.
Great. So I have a question. We've talked about the 18-month to 2-year kind of outlook for your particular industries or the biomedical sector in Maine, public health sector in Maine. Where do you see these jobs in this workforce, this STEM workforce, in 10 years? And this is a lot longer down the pipeline, but we've talked a lot about kind of the digitizing of healthcare, doing telehealth visits, and having more competency as it relates to data science and doing that kind of analysis. Do you see that as the main avenue for growth? And this is any one of our panelists. I think I sound like I'm talking to one person, but do you see this as the kind of, we're moving into more of a data analytical or data analysis focused sectors in biomedical and healthcare, or do you see some other kind of, not stress, but some other area of these sectors growing as well and probably will be more prominent in 10 years or in the next decade, within the next decade?
We at JAX certainly, hope that the data science as it relates to the healthcare sector will become more prominent. It's sort of where we see ourselves going. So we anticipate continued growth in Maine, not just in Hancock County, but across Maine in the data sciences side. I think I've been hearing from folks and friends in the Portland area that a lot of folks see Maine. I think Candace reflected on this, that Maine has so far, knock on wood, weathered the pandemic reasonably well, and people that have the capability to work remotely might come to Maine, but we think we can build, at least in the genetic space, data science capacity here in the state of Maine as a growth for us, and continued growth for us. It's a great place to live. I will say, it's a disadvantage, it's an advantage to those who can pick up their jobs and move to a place like Maine. Not everybody has that mobility or the STEM education or data science education to do that. But we think we can bring jobs to Maine and create jobs in Maine in the space, without a doubt.
I think from a testing side at Puritan, I mean, we see everything trending to a rapid at-home test, that digitally connected to a database. And that's really the future for testing, something that can be self-administered and have a result in a matter of minutes for a variety of diseases is really where we're trending, working with various startup companies through our new product development.
I think for the health workforce, STEM has always been, the girding that kind of underlies the STEM workforce, the health workforce, sorry. I think over the next couple of years, we're going to be, I think we're going to be digging ourselves out of a bit of a pit. And so the investments that we make are about rebuilding the workforce, which is going to take up to 10 years, and building a new workforce, I think, that ensures that we have the give that we need for any future emergencies. Yeah.
Thank you. So we have a question / statement from one of our attendees, David Colt, and we've unmuted him. David, are you able to chime in?
I am. Hi.
Great.
All right. I didn't know whether you want to do it this way, but yeah, I just full disclosure, I'm on the board of the Maine School of Science and Math, and we're struggling, quite frankly, because of budget constraints and the rest. And I don't know how many people are familiar with the school, but it's one of 15 state-sponsored residential STEM schools around the country. Many, as Charles, your comment about, many are in rural states, and trying, hard to sort of catch up with the rest of the world in terms of STEM workforce. Our little school was ranked #2 by U.S. News and World Report in 2019 among all 17,000 public high schools in the country. So we're proud of that. But we need, the school there's a big opportunity here. We graduate 32 kids a year. It's just not enough. And I guess my question was whether any of the panelists had knowledge or experience of how these schools have done around the country. Because the first one was in North Carolina, has been very successful. They're actually building a second campus. Obviously, North Carolina has the Research Triangle. So there's been a lot of strategic thinking that's gone into, taking a state that was known for growing tobacco and building wooden furniture 50 years ago and transforming it, which is really impressive. And trying to catch up with some of the sort of intellectual states, intellectually driven states around the country. Rue Institute is a great shot in the arm for the state of Maine. That's a graduate school and research organization. Alphon's commitment to particularly undergraduate level education in the state with their $500 million commitment is a great shot in the arm. Our little school sits underneath all of those, and we need STEM education throughout the state of Maine and high school level. I'm not denying that, but we're trying to get the administration to focus on how important it is to do what was just talked about earlier, which is start early. I guess, Candace, maybe it was you that made that point, but if these kids don't get on the first rung of the ladder, it's going to be really hard to get on it. And for the state of Maine, which, if you look at we have a huge STEM deficit. If you actually look at the numbers put out by the federal government on a state basis, we have got to do everything we can to catch up. I'm thrilled what Rue's doing. I'm thrilled what the Alfond is doing, but we need the state to step up, I think, at the high school level. And as Candace, as you suggested maybe earlier. So just looking for your thoughts.
David, thanks. I wrote in the chat already to you. I was served on the board of the school as well. I think MSSM has done great work over the years. I agree that they're having a great impact, but it's a small impact with only 32 grads. Having worked with 72 high schools across the state in STEM professional development through our program, I think we can make a difference. But and Candace is right again that it probably needs to go down into the primary grades sooner. I am familiar with some of the other STEM schools. I've been to their national conference, the National Secondary Schools of Science Conference. Really great group. North Carolina has done amazingly well. I will say the ones I'm familiar with, particularly, for example, Massachusetts, the STEM school is on the campus or adjacent to the campus of WPI.
Yep.
There's a good location. I've been really impressed with the folks at North Carolina. The investment would be well worth it. The alternative would be I think other schools in Maine have done sort of STEM academies within high schools, which is an interesting model. After serving on the regional school board here in Mount Desert for 12 and a half years, the local control issue and sort of local, each local school board determining what's important in their category, I think is, maybe this is too strong, maybe detrimental to STEM education. You don't see a lot of math and STEM after school clubs, in comparison to other co and extracurricular activities, which is a cultural thing across the United States. But it's definitely worth, figuring out how to solve STEM and encourage STEM, which I've sort of dedicated my career to at the younger grades.
Good. You and I need to talk.
We've actually met before, David. Long time ago.
Yeah, no, I know that, and but it's been too long.
I wonder if there's opportunity here, though, as Charlie was talking about, COVID is pushing us to be much more accepting and innovative with telework. And there's always that idea that rural communities, that there's potentially opportunity to develop for people to move to rural communities. My understanding of rural communities is two of the things that everybody cares about in making some of those decisions is healthcare and education, right? But that there is, if you're it's a place where all these things start to come together. And by making some targeted investment, you get short-term economic development, as well as, again, from my perspective, healthcare, if you're building healthcare 10 years down the line, all of these things that we want to make investments in that will pay off both in the short term and in the long term, public-private partnerships potentially.
The problem with the rural communities, right, in Maine is they're poor and they're small. So, hiring exceptional math teachers, physics teachers is difficult. Remote education may be, the best solution to that, and where a school like MSSM can actually put out classes remotely and create a more statewide STEM community of students. The Maine Math and Science Alliance does a great job. doing some of that work, but it's not so much on the, I don't think it's so much on the curriculum side. You know, our concern with the rural students is, again, it's a very difficult time for them to break out of a system which, you know, without that early education, it's going to be hard for them to do that. And we're the only state that doesn't provide room and board, so families have to come up with $9,300 a year to send their school. Whereas in North Carolina, it's free. You know, everything's free. And there are a lot of kids that are trapped in these small towns who have huge potential, but they'll never get out. And so we're we're trying to solve that problem. But thank you for your
Thanks,
comment.
David. Thanks, David. We, as a reminder, these sessions that we're hosting with the Maine Chamber, the goal is to develop very actionable recommendations to be used in 2021. David, I will tentatively say we will reach out to you to get more of your perspective on these topics, because I think that, one, you have a great perspective, and I think addressing the rural component and growing that STEM, growing that part of the pipeline and ensuring that we are serving the students as best possible is going to be extremely important as we move forward.
Okay, and if I can just make one more short advertisement, sure. Andre, we are presenting to the Mills administration on Monday, December 14th. It's a great, we've got a great audience. We've got Pender Macon, who's a commissioner of Department of Education, Dan Chuda, who's a deputy commissioner who's on our board, Heather Johnson, who spoke, I think was the lead-off keynote speaker to this event, who's a commissioner of DECD. We've got Hannah Pingree, who heads up the Governor's Office of Innovation and Future, and then several of, one or two of the governor's legislative assistants. So we've got an audience. I think what we may need, though, is because the state's broke and we're asking for a lot more money because of this opportunity you've been talking about. We may need to come around and ask for people to write letters of support, because I mean, I just believe this is so fundamentally important. I'm in the venture capital business. We were early investors in IDEX and WEX, and I've just been horrifically disappointed that the state of Maine hasn't created more companies like that. That's why the RU Institute is so exciting, and what Mike Dubiak has done to, you know, to get behind this whole effort. I mean, we need to think big. We can't do this incrementally. So again, sorry for getting on my soapbox.
No problem. Just know that we will be bringing that soapbox into the fold, and we look forward to working with you, David.
Thank you.
Sounds good. Okay, so that was our last question comment of the session. We're going to switch gears a bit to an additional audience participation. We want to gather some basic demographic information from the folks who are attending. So we're going to have a poll come up very shortly to get a better understanding of who's attending this session. So you should see it on your screen now.
Andre, do you want the panelists to do this too?
No, I mean, I know your background, but sure, if you want to, sure, feel free to participate. I believe the polling has stopped. We split right down the middle on if the folks on the line are engaged in STEM in a STEM field, and we have the majority of folks who were polled have a 4-year college degree. We have a lot of folks from technical backgrounds as well as the community colleges, which I think is important to this discussion about that broader workforce. So I'll pause there and I'll see if either Dana or Ben would like to have some wrap-up statements. I have a wrap-up as well, so I just want to give our folks at the chamber a moment to plug in before we convene this webinar.
Thank you so much, Andre. This is Ben Gilman. I'm the General Counsel at the Maine State Chamber of Commerce, and just want to thank Science is Us for partnering with us on this very informative webinar series. Remind everyone what you just said, Andre, that our goal at the end of this 4-part series is to make recommendations to policymakers in Augusta of how we can move STEM education forward here in the state of Maine. Just want to briefly thank our sponsors that make this a webinar possible. That's Bangor Savings Bank, Central Maine Power, Eaton Peabody, Rudman and Winchell, Mimic, which is the Maine Employees Mutual Insurance company here in Maine. And of course, our webinar series sponsor is Science is Us. So thanks everyone for joining us today. It was very informative, and I'll hand it back to you, Andre, to wrap it up.
Great, thanks, Ben. Again, we want to thank everybody for attending. We want to thank the Maine Chamber for being great partners with Science is Us. I also want to thank our panelists today for their perspectives and time. If you would like to stay up to date with Science is Us, please visit scienceisus.org. I included a link also if you want to provide information or feedback on today's webinar so that we can make these better and really tailor them to the audience. We welcome your participation in that survey. Please follow us on social media. The next session of this workforce development series will take place on January 6th and cover STEM jobs of the future. We look forward to your participation in the January session. Thanks all and have a great day.